We know that adenomyosis can cause fertility issues, and that is miscarriage. They're more likely to have miscarriage, more likely to have premature birth, and so if they didn't know they have adenomyosis and it wasn't treated appropriately before attempting pregnancy, and they can result in multiple miscarriages. And if they weren't warned about having adenomyosis, they might be going through a lot of IVF cycles, and that was not successful. So, and therefore, it is important that we are aware of this and make the early diagnosis and make sure that we get the correct diagnosis before embarking on treatment.
What should I do if I suspect I have adenomyosis?
Right, talk to your GP and your gynecologist, and make sure when they request the ultrasound, they write ?adenomyosis on the request form, so that the radiologist or the sonologist or the sonographer will pay more attention to look for those subtle signs of adenomyosis. Should ultrasound come back negative, and but you do have the symptoms of severe heavy bleeding and severe period pain, so adenomyosis is still a very strong suspect. In that situation, I think we should resort to MRI to have a more definitive diagnosis. So to get the diagnosis is the first step in getting the right treatment. So I think a definitive and accurate diagnosis is very important.
I think a huge one, all women will ask is, can I get pregnant after UAE for adenomyosis?
That's a very good question, but it's a difficult question to answer. The short answer is you get to keep your uterus. Pregnancy is possible, but pregnancy is a complicated issue, right? And so uterus is only part of the jigsaw. Okay, so first the woman needs to produce eggs, and that means that the woman's age has a significant impact on their fertility potential. These days, women are delaying relationship and they're delaying their family planning. So quite often, by the time they want to have a baby, they are already in their late 30s. As we know, women from age 35 onwards, the fertility potential will reduce because of the egg reserve is one thing. The quality of the eggs is another thing. These both will decline from the age of about 35, and the cliff is even deeper beyond 40 years of age. So the egg is one factor, and the uterus is the other factor. So adenomyosis affect the uterus. Adenomyosis itself has negative impact on fertility and pregnancy because the adenomyotic tissue create a very hostile environment for implantation, and also for the embryo to develop as well because of the abnormal blood supply in the area. Okay, it's just a very hostile environment for the embryo to thrive. So after UAE, would that situation improve or not? At the moment, we don't know. We do know a few things. Number one, after UAE for fibroids, there has numerous case studies, not case studies, actually case series, meaning that larger number of patients. And there are even a couple of meta-analyses looking at all the data together. So the conclusion that the meta-analysis has is that women can still get pregnant. The pregnancy rate is not low. The overall successful spontaneous full-term pregnancy is between 30 to 48% after uterine artery embolization for fibroids. What's reassuring to know also is that the babies are not smaller. There's no intrauterine retardation after UAE for fibroids. There's a but the miscarriage rate is a bit higher, premature birth is a bit higher, and pregnancy-related complications and cesarean section rates are all higher than what? Than general obstetric population. But these women having UAE for fibroids have problem with the fibroid. The uterus is not normal. So the uterus is not normal to start with. So you can see, is it the treatment or is it the pre-existing condition that already predisposes women to have fertility or pregnancy issues? We don't know. Adenomyosis, perhaps we know that it has worse impact on women's fertility and pregnancy than fibroids in general. So, and that's why at this day and age, we don't have the data to say whether the UAE has a positive or a negative impact on fertility and pregnancy, and then we don't know yet. The other people question is that does UAE procedure harm the ovaries? Okay, obviously, if the ovaries is harmed, then the woman can't produce eggs and can't have pregnancy. So the answer to that is quite important, and that's a relevant question. Does UAE affect ovarian function? Now, there has been previous studies, so there are a few things we know. Number one, UAE does not seem to bring forward menopause, so that's reassuring. And then some people have studied the hormone changes after UAE. So some studies show that there's no hormone changes after UAE. In other words, it hasn't done any damage to the ovaries. But there are other studies showing that there's a transient decline in a hormone called AMH, which is the predictor of ovarian reserve. That kind of dip after UAE. But in younger women, that seems to recover, afterwards in younger women. So we don't have a definitive conclusion to answer that question, but we know that most women did not have an early menopause after UAE.